Hello, everybody. My name is August Alm, and today we're going to be talking about rosacea. What is it? What is it? And what are the causes slash physiology? Rosacea is a chronic skin condition that primarily affects the face, causing redness, visible blood vessels, and in some cases, the development of pimples and pustules. There is no exact cause for rosacea, but an overactive immune system, genetics, diet, and environment is known to have an effect on rosacea. Contrary to popular belief, rosacea is not caused by bad hygiene and it is not contagious. So the stinky ones in class, they're not getting rosacea just because of that. What we do know about what we do know is that rosacea is the inflammation of the skin normally on the face. There are many reasons that the skin on the face can start having inflammation. Having an overactive immune system or abnormal blood vessels is what can cause the severe inflammation and redness from rosacea. Reactants can be environmental. Foods with high histamines, like aged cheese, smoked or fermented foods, can cause increased symptoms. Histamine is involved in the body's inflammatory response and can contribute to the redness and swelling. Even spicy or acidic foods can increase the symptoms of rosacea. There have even been studies suggesting that microscopic mites, called Demodex mites, can cause rosacea. Isn't that creepy? Little microscopic mites crawling on your face, biting you. That could cause rosacea, which is a little scary. The important thing is to avoid lasagna at all costs if you are afraid of having rosacea, or if you have rosacea, it will increase your symptoms. Lasagna has not only tomato sauce, but ricotta cheese. And you may be thinking to yourself, what does that have to do with rosacea? Tomato sauce is very acidic. You may not think it, but it is. And very acidic foods can increase your symptoms of rosacea, or maybe even cause them. And you don't want that. Not only does lasagna have that, but it has ricotta cheese, which is aged, fermented, I believe. I don't know. But you know what that has? Histamines. Histamines are involved in the body's inflammatory response and can contribute to redness and swelling. Eating lasagna is pretty much just asking for rosacea. Do not eat lasagna. But that's all for me, folks. I'm going to give it to my colleague Joshua talking about risk factors. Have a great day.
Risk factors for rosacea. Ultraviolet radiation exposure, 37 and higher vitamin D levels have been noted to associate with rosacea. 65 vitamin D levels, which can be increased by exposure to ultraviolet light. Ultraviolet light works just like cooking. You overcook it, you get burnt. You get too much ultraviolet light, you get red. Family history of rosacea is common. A recent study in 233 identical and 42 fraternal twin pairs found a higher correlation of rosacea clinical scores between identical than fraternal twins, and estimated a genetic contribution of 46%. Lighter skin types, a genetically determined trait, is associated with rosacea risk. Vascular abnormalities result in blood vessel dilation with increased capillary permeability and edema, which in turn provide a favorable setting for proliferation and colonization of Demodex mites.
Now, we've got you guys some cookies. They're not just any cookies, they're strawberry cookies. When you look at the strawberry cookie, all you see is that nice pink-red top. And if you really want to think about it, it's like the first stage of rosacea. Just look at your skin. Is it red? Is it pink? Is it bright? You probably got rosacea if you answered any of those yes.
Leading into the signs and symptoms of rosacea, there are about 6 symptoms typically found, the first of which is facial reddening and flushing, and this is due to the skin taking on a pink or purple hue. Next is visible veins, which may become visible in the nose and cheek due to rupturing of those veins, and this is also described as spider veins. Swollen bumps containing pus can also become visible on the face, chest, and back. This is typically diagnosed as it is very similar to resembling acne. A burning sensation may also be felt, typically affecting the acne-ridden areas of the skin, causing them to feel hotter and become tender. Eye problems, also called ocular rosacea, occurs when eyes become dry, irritated, and both the eyes and eyelids tend to swell. Lastly is an enlarged nose, also known as rhinophyma. The nose becomes enlarged as the rosacea thickens the skin in the affected area, and this often occurs more in men than women.
Let's talk about some treatment options you have. Treatment, all in all, really focuses on controlling the signs and symptoms of rosacea. It is highly treatable, but unfortunately, it does have some really bad negative effects to your skin and your overall integumentary system if you don't really address it early enough. It often combines both good skin care and prescription drugs. The duration of your treatment really depends on the type and severity of the disease, unfortunately. So, you just got to tend to every case on a one-on-one basis. But thankfully, reoccurrence is obviously not an issue, and it is not that common as long as you're following all the medications, right? New rosacea medications have actually developed in recent years. The type of medications your doctor prescribes depends on which signs and symptoms you're experiencing. So you may try different options and combining drugs to find treatment that works the best for you. Obviously, you guys heard about the cookies. Make sure you're looking out for yourself. So enjoy those throughout the presentation. Biggest thing that drugs try to go ahead and help and try to remedy is the flushing that rosacea does cause. For mild to moderate rosacea, your doctor may prescribe creams or gels that you can essentially just apply to your skin, right? The reduced flushing is essentially a product of constricted blood vessels in that area, so you actually might see results relatively quickly, no longer than 12 hours after them being used. The effects on your blood vessels themselves are pretty temporary, so you know, you don't have to worry about that, cardiovascular people. Other topical products help control the pimples of mild rosacea. These drugs include oxalic acid and metronidazole. So those are some medications similar to like ivermectin, for example. They do have pretty noticeable improvements that generally don't appear from 2 to 6 weeks of initially taking them, but if you do stay consistent with them, they usually do help improve skin and reduce that scarring tissue that the acne or the rosacea itself may cause. When it comes to other medications, a lot of it is also oral. So your doctor may actually prescribe oral antibiotics such as doxycycline for moderate to severe rosacea with bumps and pimples. Sometimes you don't have obviously those really bad outbursts, but if you do, usually that doxycycline is going to be your best friend. There are some other oral acne drugs that they will go ahead and give you. If you do have severe rosacea that doesn't respond well to other therapies, your doctor may suggest isotretinoin, which is essentially a very powerful acne drug that also helps clear up acne-like lesions of rosacea. So don't use that drug, obviously, if you're pregnant. So just make sure you consult with your doctor. So our group decided to do a case study for rosacea. Obviously, you're going to see some not so pretty pictures behind me, but the story behind this case study is we have a 28-year-old female. Obviously, was presented with extensive facial and ocular eruptions, which is essentially, around the face, the eyes. She did have a history of oral treatment of prednisone due to clinical diagnosis of lupus, which has resulted in transient improvements of the lesions, but it was followed by exacerbations of the lesions. So you got with the clinical diagnosis of severe oculofacial rosacea, she was successfully treated with oral doxycycline, steroid eye drops, and ocular lubricants. Histopathological features of skin biopsies were consistent with rosacea in the context of infection, but after about 4 years, a relapse did occur with this patient, unfortunately. The oculofacial lesions did reoccur, and the treatment with the tetracycline did ensue. Steroid eye drops and other ocular lubricants were administered. So after 4 years, doctors did go ahead and realize they actually misdiagnosed the lupus. It was actually rosacea the whole time. So make sure to go ahead and always check with your doctor. Make sure you're doing all the biopsies if you obviously do have it. Hopefully you never do. But make sure you get a right doctor, a second opinion, so that this doesn't happen to you.
In conclusion, rosacea is a chronic skin condition that primarily affects the face, causing redness and visible blood vessels, along with pimples and pustules. The clinical outcomes of rosacea can vary widely from person to person. While rosacea itself is not a life-threatening condition, it can have a significant impact on a person's quality of life and self-esteem due to its visible nature.
Treatment for rosacea varies depending on the severity and specific symptoms experienced by an individual. It often includes topical and oral medications. lifestyle modifications to identify and avoid triggers, and laser therapy for visible blood vessels and thickened skin. Early diagnosis and appropriate management can help control the condition and improve clinical outcomes. It's important for individuals with rosacea to work closely with a dermatologist to develop a personalized treatment plan tailored to their needs. That's all, folks. Thank you. Have a great day. Hey guys, it's me, August, again. Here at the end, I just want to let you know we brought a lasagna to the class. The reason we brought lasagna is it kind of looks like rosacea of the skin. I mean, if you think about it, you got the white cheese on top, tomato sauce boiling up through. That's a good lasagna, by the way. It's got to be boiling up through. It kind of looks like rosacea. You got your tomato sauce, super tasty. You got your ricotta cheese. Who doesn't love a good aged fermented cheese? I mean, come on, guys. But I hope you enjoy. I hope you enjoyed our project, and have a great day.